6:48 in Trinidad and Tobago. Well, let's talk now about an initiative designed to target some of the youngest in our society as to the dangers of alcohol and drug abuse. Trinity S.M.A.R.T, it's a mini-series produced by NADAPP, that's the National Alcohol and Drug Abuse Prevention Program of the Ministry of Health. The aim is to sensitize preschoolers on the adverse effects of alcohol and other drugs. The ministry believes that this is a key target audience in the fight against drug abuse. Well, let's hear now from Lyra Thompson-Hollingsworth, who is the coordinator of NADAPP. She joins us now. Very good morning. Sorry, I said Lyra, it's Lyra, is that correct?
It is Lyra.
Lyra. See, I get it wrong twice. So thankfully you're there to correct me. So Lyra Thompson-Hollingsworth, thank you very much for taking the time to be with us this morning. When I read the introduction, I had to kind of catch myself and say preschoolers, because as far as reaching that group, are you confident that preschoolers will get the message that will be disseminated and fully understand what the message is being sent to them?
Yes, we are. In fact, over the years, we've done a number of school-based surveys, and all of these surveys consistently state that children in Trinidad and Tobago start using some kind of substance as early as the ages of 7 or 8. And even when working in the field, when you go out and so on, little children tell you about alcohol and cigarettes and so on, and they're very okura of what is out there. So coming out of that research a few years ago, we started doing these sensitization workshops for preschool teachers and managers. And coming out of those workshops, they were the ones who suggested we develop materials that would be appropriate for preschoolers. So there were a number of consultations and focus groups and piloting and so on. So this is after a lot of work has gone into it. And it's at the point now where we've had videos developed and books and puzzles and so on. And we've done the requisite training with the with all of the administrators and teachers of all the educational districts. And we even went a bit further and did some training for first year and second year teachers in the primary school system. So it's at a point now where it's being rolled out in schools, and we're currently at, getting information back from the schools in terms of what the level of implementation is like, and it's currently being shown on another television station at the moment. So it's at that point where it's being rolled out, and we're very, very proud of it. And yes, we're confident that it's going to reach not only preschoolers, but because of the nature of how children are, they are also going to reach their parents. And because it's being shown on television now, it's an animation format, people are going to get to see it, and the message is going to go a little further than preschoolers. So we're happy about that.
And where can parents access this? Because, you know, as you would be aware, we're kind of in this transition period right now between online to back to in-class learning and so on, and we see all the teething problems that are being experienced there. Is this something that can be accessed independently by parents?
Yes, the videos are currently on the Ministry of Health's YouTube page, and they're being shown on the Facebook page as well for the Ministry of Health.
And as you said, it's already out there. Is this an ongoing series? Is there obviously there was a start date. Is there a finish date for this program, or is it going to be an ongoing exercise?
It is going to be ongoing. So we'll on an ongoing basis, we will conduct exercises with Ministry of Education personnel. And so as the children move through the education system, even with this cohort of preschoolers, there are other activities for primary school and secondary school, because we've done training with guidance officers, and this year we'll be doing some training for school social workers. So Ministry of Education is a key stakeholder when NADAPP is concerned, and we have programs in place for the child at every stage of their educational experience.
Well, that was I was going to ask you, because it's good to know that this program is starting with the very, very young to try and reach them while they're young. But what about those
Yes.
primary school students, the secondary school students who may be the most vulnerable as far as looking at that situation? Are there programs already in place and functioning right now?
Yes, there are. Um, in Ministry of Education, substance use is a curriculum item for guidance officers. So what we've done is that we've reached that cohort of professionals and trained them to implement drug education in the classroom. So in 2020, when COVID hit, we immediately switched to a virtual platform and we did the training for all our guidance officers across all educational districts in Trinidad and for the THA in Tobago.
And as far as this particular series for the preschoolers, what sort of feedback have you gotten so far? Because I suppose so critical responses from maybe parents or others who would have seen the videos and maybe give their own critical analysis of it. What sort of feedback have you gotten?
We've been getting feedback from the schools at this point, as because it's this early in the game where our monitoring and evaluation system is concerned. We haven't received feedback from parents as yet, but that is the next step, certainly. But the feedback from the schools is that it's being implemented and that children are generally excited about it. The animation series is it's really really good and it's relevant and it's catchy, and I think it is something that it is going to catch on in good time.
And tell me about the creative process in that, because of course you want to get the message across in a way that obviously will reach them. I mean, some cartoons these days, I mean, as an old man, when I watch them, I can't watch that because it's a little too violent or a little too crazy for me, from a old school kind of thing. But how did that creative process work in coming up with not just the content, but the appearance of the characters and so on to ensure that you'll reach those preschoolers?
Yeah. Well, we had focus groups with preschool managers and teachers, and I believe a couple of parents were involved. And so they were brought together and we developed the characters, we developed the script, we met with the animation company, and even the voiceovers are children. So they would have had an input in the process and how it was brought to life. And even when the videos were developed at a very early stage, they were piloted at a few preschools across the country. And so we got feedback from the children and how they responded to it and so on. And then we were able to roll it out.
And just so we could understand, if I asked the question already, but I kind of asking it differently now. If anyone who are engaged with preschoolers or who has a facility in which they are taking care of preschoolers and they weren't aware of this, do they go on the Ministry of Health website? Do they contact NADAPP to access the videos? How does it work?
Okay, I think the best option in that case would be to contact us because we trained as extensively as we could have, but sometimes persons may have missed out. So the best option would be to email us at nadapp@health.gov.tt. So that's NADAPP at health.gov.tt.
nadapp@health.gov.tt. And
Yes.
as far as this broader challenge of drug and alcohol abuse, I mean, I suppose the best thing is to tell people don't watch TV because the kind of glamorization that occurs with alcohol, I mean, it brings in a lot of money for us, but the point is the impact. And how do you describe that challenge from a NADAPP point of view? This constant battle with not just the illegal side of things with illegal drugs and whatever, but the acceptance by wider society of a drinking culture or an alcohol culture, and trying to protect the most vulnerable from the negative impacts of that. How challenging is that?
It is fairly challenging, and I think one of the ways we've been able to combat it is addressing it in a realistic type of way. There are particular, as you indicated, there are particular vulnerable groups that should not touch alcohol at all. So that would be a person with a substance use disorder, if they're an alcoholic, or if they have of alcoholism in their family, they should avoid it. Children under the age of 18 should not touch alcohol at all, and I would dare say persons under the age of 25 ought not to touch alcohol or any other drug at all because of your brain development. The brain continues to develop up to the age of 25. so that if you attain the age of 25 without touching any kind of substance, it is likely that you're going to be in a better position to make good choices going forward in life. Um, and that is the best advice that I give people when it comes to our drinking culture. What we tend to do, I mean, before COVID, we would have special initiatives around Carnival time and Christmas time, and we take a harm reduction perspective. So we try to tell people how to drink to avoid harm related to drinking. So heavy episodic drinking, how to avoid that, remaining hydrated, spacing out your drinks, how to avoid hangovers, and so on. And I think people who are generally adults and enjoy a drink now and again, they appreciate those messages, and it is very, very helpful for
Lyra
them.
Thompson-Hollingsworth, coordinator of NADAPP, thanks very much for taking the time. What did you say that the brain develops, reaches peak development at what age?
Age 25.
25? Well, my wife
Yeah.
told me my brain stopped working at 24 just after we got married. So I'm 1 year behind in that regard. But Ms. Thompson-Hollingsworth, thanks very much for taking the time to be with us this morning.
Thank you for having me.
You're more than welcome. We might be joking about other things, but it's a very serious situation, the issue of drug and alcohol abuse in Trinidad and Tobago and the wider world. Let's not pretend that it's unique to us, but we have to deal with what we have to deal with in Trinidad and Tobago. Well, let's take a break because we're coming up towards the news at the top of the hour. And as we do so, let's check on the traffic situation coming into the capital city. And it looks as it's quite heavy coming in this morning. Maybe more children out of school. There we see a heavy vehicle coming out of probably the NPC lots area as well. So we urge everyone, there's somebody crossing the road also. You also have to be mindful of that. You might feel it's safer to do so with the traffic at a standstill, but you always have to be careful of vehicles speeding along. It's early morning in Trinidad and Tobago, 7 o'clock, time for the news.